Hey guys, so I'm not just making a video about hair loss here. I've actually been experiencing it myself. So I want to show you, take you into my bathroom. This is what I've been dealing with lately. So I'll be washing my hair and literally like clumps of hair, strands will just come out of my head. And this has been really concerning for me. I've always loved my hair. I felt like it was one of my best features. So to feel like I'm losing it now makes me worry, makes me feel insecure, self-conscious. There is a treatment called PRP that is really helpful to women that are experiencing this thinning and really noticeable, balding and hair loss in these specific areas. Usually it's around the hairline at the very top. So I can't wait to show you the PRP process with Dr. Deanne Robinson, who I have filmed with before. You might remember me getting Cellfina at Dr. Robinson's office, but, well, literally, but that's a whole nother treatment, and you can watch that video in the box right here. Now let's take a look at PRP. We'll get a second opinion and hear some personal hair loss accounts.
When did you first notice it thinning?
Probably after menopause.
Which is, again, very common. Hair loss in women can be very hormonally driven and linked, yes, similar as to men.
Yes.
So we notice it during menopause, after pregnancy, there can be a loss of hair, sometimes with birth control starting or stopping it. So it is very hormonally tied and hormonally linked. Did you notice your part getting wider?
Yes.
And that's a really common spot for us as women to notice hair loss. With men, we think about the bald spot and then up by the temples, but as women, sometimes one of the first signs we see is that widening of the part.
But you know how we women are about our hair?
Yes.
We want it to look beautiful.
Of course.
When it starts thinning, we get nervous that more is going to fall out.
Of course.
Yes.
And 40% of hair loss sufferers are women. And I think for us, there is so much self-confidence and social stigma attached with it, so it's a huge, huge issue. So what we're going to do today is the treatment called PRP, or platelet-rich plasma. So what we're going to do is take the blood, draw it, spin it, which is going to help separate that rich plasma from the red blood cells. The red blood cells we get rid of, and the PRP we inject into the spots that we're noticing the hair loss. Usually it's a series of treatment. 3 usually separated over a month, and it takes a full 6 months for our hair growth to kind of kick back in that hair cycle. So we'll really notice that results after about 3 to 6 months, and then we can reassess and kind of see where that takes us. But most people notice an increase kind of in the density of hair, less hair falling out, and regrowth of those little areas.
So here we go as Dr. Robinson preps PRP and the patient's scalp.
So I use a super fine little needle here and just do little injections right into the areas. Doing great. How you doing?
Okay.
Little pinches, right? A little bit of pressure as it goes in. What we want to do afterwards is we want to keep that PRP where we injected it. So for 24 to 48 hours after, you don't want to really massage the scalp or do like a vigorous shampoo, just because we want to keep that PRP where we put it.
So that was really cool watching the PRP treatment. How often are you doing this?
We have people coming in quite often for this, men, women, younger people, older people, so probably a few people a day that we end up treating. Generally, it can range from about maybe $500 upwards to $1,000 per treatment. Obviously, this is a big investment for patients to do these injections, so we want to try to supplement and do as much for them at home as we're doing in the office. So taking a supplement such as the ISDIN hair supplement that has biotin, some other nutrients, saw palmetto extract, which helps block the conversion to that active testosterone, the DHT, which causes the hair loss, is something that's really important. People want to do something at home that's also going to help. And then using the shampoo, which helps to thick and fortify the hair, and the lotion, similarly, which kind of gives like a nice luster and sheen, but also a thickness to the hair, just makes people feel better on a day-to-day basis.
How does it make you feel that you're helping these women?
I love it. I think as a woman and as a provider, I love being able to do something that meaningfully reflects on our self-confidence, how we, identify ourselves, how we deem ourselves. So it makes me really happy to be able to do it for people.
It's always good to get a second opinion, and I was curious what kind of success other doctors were having with PRP. Meet Dr. Brock Reidenauer of Reidenauer Plastic Surgery.
We treat patients with hair loss with increasing frequency. The reason for that, I think, is because we are now using non-surgical methods to manage hair loss that are quite effective, where in the past the only options were really surgical sorts of procedures. 50% of women in their 50s and 60s will experience this type of hair loss that's androgenic in nature, resulting in a loss of hair density that can be quite devastating and certainly can be quite noticeable.
My name is Amparo. I done a detox and all of a sudden my hair was just, I could see significant thinning. I could see more in the shower. I began seeing some of my pillow, and that was really frightening. So that's when I realized something more than the normal shedding that you get between seasons. I could notice, especially after I washed my hair, that it looked thinner in the back. And that's, like I said, when I began getting concerned. People may see that I still have a lot, and I hope I continue to, but there is a lot missing, especially in the top of the head.
Stress is involved in a particular type of hair loss called telogen effluvium, which is a sudden and precipitous sort of shedding or falling out of the hair that tends to be temporary in nature.
My name is Jessica Kalila, and I'm a yoga instructor at Yoga 6. So I began to notice the hair loss. It was about 5 or 6 months after having Oliver, my second child. This happened with both of my kids, but it was to a much more intense degree with Oliver. I would wash my hair and my fingers would just be webbed with hair coming out in clumps. And I was also going through postpartum depression at the time.
You should think of hair like a plant with a root system underground. And that root system requires the proper nutrition, the proper blood flow, and the proper hormonal interactions in order to flourish.
I noticed the last few days something is beginning to fall out more the last couple of weeks. So would I try something else? Yeah, I would like to.
It's platelet-rich plasma. Why is platelet-rich plasma important? It's because the platelets carry a powerhouse of wound-healing factors. And they're our first-line response to injury, the platelets are, and they release hormones and growth factors that stimulate a healing response. It turns out if you take the power of those platelets, that there tends to be some regenerative capability of those particular proteins on hair follicles. And what we think happens with PRP is we're stimulating those potential cells to regenerate a healthy follicle. We've been very, very happy, and our patients have too.
Our doctors have told us that PRP works, and these post-procedure pictures of our patient who was treated at the beginning of this video really say it all. You can see all the regrowth that she's experienced, and these pictures were literally taken within months of her first PRP treatment. As for our yoga instructor Jessica, and even myself, we're not quite there yet where we feel we need PRP.
I would be open to supplements, shampoos, anything that can help.
So I gave Jessica the ISDIN Healthy Scalp supplements that I've been using to nourish and feed her post-pregnancy hair.
So it's definitely an emotional attachment to your hair. It's to how you look, who you are.
Amparo is spot on when it comes to women and their hair. It's how we see ourselves, it's how we express ourselves. Our hair is our greatest ornament. That's a quote by someone famous, you can probably look it up. And you know, when you start to lose your hair, it affects us in that same way, especially when you feel like there's nothing you can do about it. So I want to continue this conversation and movement to sharing, you know, solutions and treatments that can help us maintain and stimulate the regrowth of this hair. So if you're experiencing this, you know someone who is, please share this video, like it, and let me know what you think in the comments below. Thank you.